Okay, so tonight we have three famous Californians who work on the issues of saving our democracy as well as protecting us from climate change. So maybe I'll let the three of you somehow divide up who's going to introduce who. But Cynthia Mahoney, who's regularly on our team, and her colleagues Margie Chen, and Karina Maher.
Okay. Um, so do we need further introduction or because you had it in the announcement, but
Sure, a little bit.
a little bit? Okay, well, I'll go ahead and start. Hi, I'm Cynthia Mahoney. I'm a retired nephrologist from the Bay Area, San Francisco Bay Area, that is. And yeah, I started out with CCL. That was my first climate activity. So feel right at home here. And I will pass it to Karina Maher.
Karina Maher, I'm a pediatrician in Los Angeles, and I met Cynthia and Margie when we were working with Climate Health Now, the affiliate, the California affiliate for the consortium, and we've grown up together ever since. Margie?
I'm Margie Chen. I'm a retired OB/GYN in San Francisco, and we started with this voting for climate and health, which was an offshoot of Climate Health Now. And we've now morphed into, well, we were part of Rob's subcommittee, civic engagement and advocacy, but now we've moved over and to the state affiliate network as the first issue-based group, and we're now climate health, civic health. So we're happy to talk to you today.
All right. So I'm going to share screen if that's okay. And slideshow. We'll see how this works. All right. So hello, everyone. It's so good to be here, and thank you for this opportunity to share our work on civic engagement with y'all. CCL was my first climate home, and the leaders of the Health Action Team, Lisa Del Buono, Lori, and Rob Byron, have been inspirations and mentors to me. So I'm here with my colleagues, Karina and Margie. Together, we co-founded Voting for Climate and Health as a spin-off of our California state affiliate. And this photo shows one of our earliest campaigns when we were lobbying our senators in 2020, along with a coalition of other climate health groups, in order to strengthen voting rights and democracy in order to be able to address the climate health emergency. And here's a brief overview of what we plan to cover. So we expect this will be about 30 minutes, so we should have plenty of time for discussion at the end. So we're here because we all know that climate change is a public health emergency, a code red for humanity. And each year that we delay locks in more harm. Research confirms that we are breaching planetary boundaries much faster than was predicted, and individual action cannot solve this. I don't have to tell you, CCL folks, that what's required are policies, collective action to drive down CO2 emissions. We have the technology, but how do we create the political will? We care for many reasons, but especially for health. And this iconic graphic shows in detail the health impacts, including mental health. And I know you are familiar with the health issues. I'm not going into detail on that, but I want to point out that these health impacts are rapidly overwhelming our ability to keep our patients safe. So Karina and I started our climate health work with a focus on education, educating policymakers and health professionals about these health impacts of climate change. But the more we worked in this area and learned about why climate action has been thwarted, the more we realized that a lack of education is not the fundamental problem. So alone, it can't be the solution. The problem is the powerful forces aligned against and blocking climate action, the money of fossil fuel interests and the politicians they support. We realized we needed to expand our approach to include civic engagement. And I'd like to share some of the highlights of our journey to understanding this, starting with our medical training. So it's been quite some time since Karina and I finished our training, a little more for me than her. But most of our time in practice, and still to this day, the approach to patient care has been primarily limited to the specific presenting condition and screening for some other health risks. Karina?
You kind of skipped.
Did I skip something?
Yeah, it's okay. Yeah, so it's fine. But our focus was on the individual and their physical complaints, so organ systems, pathophysiology, administration of medications, etc. And sure, we learned how to take what we call a social history, who lives with a patient at home, what work they do, where do they go to school, but there wasn't really much emphasis on how or to what degree that might affect the patient's health.
So we were stunned when we first saw this image 5 years ago, depicting what goes into our health. Although you who trained more recently are likely very familiar with the depiction on this slide, the term social or environmental determinants of health is relatively new, not used during our training. And previously, it had been an unspoken presumption in medicine that most of what impacts a patient's health has been their lack of, or their medical care or lack thereof. And that's how patient care has been traditionally and perhaps arrogantly approached. We practiced that type of medicine for decades. But now we know that the direct health care, this bottom 20%, only comprises a small fraction of what contributes to a person's overall health, where the socioeconomic factors, the social determinants, and physical environment account for 50%. And with accelerating climate change, this is only going to be larger. And as we see here, the social determinants of health, the social determinants of health are nested in ever expanding domains, starting from the individual in the center through to lifestyle above that, and community, the local economy, patients' activity and lifestyle, their built environment, their natural environment, and the global ecosystem. Climate change is fast becoming the single greatest of the social determinants as it affects this global ecosystem. What makes climate change a social determinant is that although it's a physical environmental factor, it is in fact human caused, and from burning fossil fuels primarily and deforestation. And the impacts are inequitable. It's a result of structural drivers, the policies, laws, and regulations, predominantly regarding fossil fuels. And as a result, fossil fuel interests are able to block action through political influence, campaign contributions, lobbying, politicization, public relations campaigns, and greenwashing. The impacts of climate disruption are accelerating with tipping points that affect not just us as individuals and isolated communities, but the whole global ecosystem that sustains life on this planet. It impacts vulnerable communities the hardest, and they have the least resources to respond and adapt. Let's look more at the structural drivers. Wait, I'm going the wrong direction. Sorry about that.
Right. So this graphic shows how the health impacts in the white circle are downstream of the social determinants of health in dark blue, and then upstream in lighter blue are the structural drivers. So voting has been called the most important social, sometimes called structural determinant of health. Voting is a specific form of civic engagement, and then so we can all be on the same page, I'm sure you know this, but broadly defined, civic engagement can be described as actions that individuals or groups take to address the well-being of their communities, their social groups, or society as a whole through both political and non-political processes. So civic engagement with voting as its foundation plays a crucial role in shaping the policies and systems that impact all other social and environmental determinants of health, health equity, and healthcare access. And voting has been called the most important of our rights because it is preservative of all other rights. And recently, it's been shown that civic engagement and voting are strongly associated with both individual and community health. So this slide, this was shown empirically in the Health and Democracy Index. And this screenshot from the index shows all 50 states as those gray little boxes. And it's hard to see, but you don't have to squint to just on the horizontal or x-axis is voting access, and on the vertical or y is overall health. So when there's more voting access and civic participation, there are better health outcomes. So that would be the states in the upper right, which are Massachusetts, Vermont, Colorado, Hawaii, Utah, Washington, Maryland. And then communities that face significant barriers to voting suffer from worse health outcomes. The states in the lower left, so they have less access and worse health. So those are Texas, Mississippi, Georgia, Missouri, Tennessee, Kentucky, Arkansas. So a lack of social inclusion, reduced sense of belonging, and less access to health resources are all associated with worse health outcomes, from higher infant mortality rates to greater risk of chronic disease. This low voter participation drives health disparities, which then become self-reinforcing as people with worse health face significant barriers to voting. But thankfully, the reverse is also true. So higher levels of civic participation can mitigate these disparities and health improves. And not only does voting influence policy, voter participation is associated with better self-reported health and increases in physical and mental health. Yeah, so this diagram is of a virtuous cycle, and it illustrates how civic engagement and voting in particular help to direct policies, which in turn lead to better health. So because policies and laws determine the condition of our environment, and the people we elect determine those policies, and elected leaders respond to people who vote therefore influence their health outcomes. So in our case, climate solutions are an example of a health challenge that in a democracy can only be addressed through civic participation. But of course, we all know there are flaws in the system. No system is perfect. And because democracy is our tool for addressing climate change, we all have a stake in a well-functioning democracy, health providers and patients alike. So that's why in the former administration, the Department of Health and Human Services made voter participation a metric for the Healthy People 2030 campaign. But now all of this is being flipped on its head. There's an intensive effort to restrict voting options and opportunity. I mean, it started decades ago, but has been finding momentum in the last years. So a quick example of how important it is to have a variety of options for when and how to cast a ballot. For example, how important mail-in voting is. I was displaced due to the Palisades fire in January, and I've been living at a temporary address in a different district ever since. And even though we had our mail forwarded, our mail-in ballots and voting information never arrived, and never mind all the cuts in the mail system that happened a few years back. But our whole town burned down, so we also had no in-person polling place. So it took an effort on my part to figure out, and what I mean is it wasn't so easy to figure out. We had to re-register completely and do it in a special way to keep our voting district the same, but change our mailing address. So it really brought home the disenfranchisement so many Americans experience. People who are disabled or sick or have to move frequently or are unhoused. I mean, we know they have issues with voting, but I mean, chances are their vote won't count. They won't even probably have the opportunity to vote. So to summarize so far, we've shown that climate change is a public health emergency and a social determinant of health, that voting is a social or structural determinant of health, and that when patients or people in general are voters, health improves. So by actively participating in a healthy democracy where everyone has access to voting and every vote counts, patients can improve their health, their community's health, and planetary health. So we conclude that voting is a climate, health, and equity solution. And we, the healthcare community, have a unique and special role to play. The healthcare community's voice is powerful and trusted. We have a unique connection to our patients, many of whom are most harmed by fossil fuel pollution and the climate crisis, yet are not consistent voters or even registered to vote. And as health professionals, we can empower our patients to be informed voters for health and climate. So using our trusted voices to educate patients on how their vote can promote policies that improve their health is better patient care. A very strong argument why civic engagement belongs in healthcare. This is a new paradigm that expands the dimensions of patient care from how we currently practice.
Okay, right now, even those of us who recognize the health harms of climate change are primarily focused on managing the patient's presenting health problem, whether it's heat stroke or vector-borne illness or an MI. The key point here is that the individual care we provide is no match for the growing harm and suffering of environmental degradation and the climate crisis. As Renee Salas, an ER physician and senior author of the Lancet Countdown on Health and Climate Change, says, we are putting a Band-Aid on a bullet wound. Collective action to drive the policies that protect health is required, and that depends on civic engagement. It's clear that to provide complete patient care, we need to incorporate nonpartisan civic engagement into our practice. The era of climate consequences calls for a new paradigm of clinical care. There are 4 dimensions that involve including the patient in climate solutions, which we'll go over in a few minutes. So we retreat from the patriarchal top-down approach to patient care and expand our perspective of democracy and civic engagement to involve the patient in their own health care, so they know they can use their voice, their power, to influence the environment, the climate, and their health. We mentioned earlier that the traditional practice of medicine focused on the model of disease treatment, the chief complaint, and how to treat it in our own office one-to-one. And many still practice this way. There may be resistance to changing the paradigm to incorporate civic engagement. And I hate to admit it, but if 20 years ago I had been asked to incorporate civic engagement and voter registration in my clinical practice, I would have bristled. I thought giving the best individual care was being a good doctor. But that was before we understood the social determinants of health and the health benefits of civic engagement. Now we do know better, and now we have the tools to make it easy.
And with this in mind, we envision a health community that now treats climate disruption as a major determinant of health and incorporates nonpartisan civic engagement and advocacy with policymakers and patients alike as part of our professional and ethical duty in caring for our patients. And we ourselves can advocate with our electeds for bolder climate action. To make this a reality, we will need to activate and mobilize the healthcare community to advance evidence-based, equitable climate solutions through nonpartisan civic engagement and advocacy, all predicated on a healthy democracy. The question is, how do we accomplish this? Oops. So what can we, the health community, do? We can educate, educate patients and policymakers on the connection between climate change, fossil fuel pollution, and health, and between their health and their vote. We can talk about environmental burdens and climate change as a health issue to depoliticize them and build collective will. We can promote nonpartisan civic engagement for ourselves, our colleagues, our organizations, and our patients. We can integrate civic engagement in healthcare settings, especially for our patients who are most affected by the social and environmental determinants of health, and foster informed voters for health. We can advocate and press our elected leaders on bolder, more equitable climate action. And then we can amplify. So joining a health advocacy group, there's a lot we can do as individuals, but so much more with collective action. And it makes the work easier and fun.
So I'm sorry the slide isn't loading properly. All of that should have been
Let's
printed out.
Sure.
Maybe I'll go on to the next one, Karina. And if it's not loading, maybe you could try sharing your slides instead. I'm not quite sure what's. Oh,
It takes a
like
minute.
that.
Yeah, it just takes a minute.
I clicked it again. Maybe for some reason it's doing double. So educate, promote,
Oh,
integrate, foster, advocate, and amplify.
yeah.
Okay, let's try. There it goes. I have to do a double click for this.
That's
So,
animation, Cynthia. Somebody animated the slides.
Yeah, we did it. We didn't even know it, Cynthia. Good job.
oh,
We were
okay.
trying to do that.
But we didn't know we had. High tech here. We told you we trained a long time ago. So, our ask of you is to join us in moving from theory to practice. And here are some ways to do this. Start with communicating with patients, colleagues about the connection between climate disruption, health, and civic engagement as a solution. And here's a sneak preview. Oh, I'm going the wrong direction, sorry. Try that again. I have to watch where I'm driving.
I really do think I accidentally did those animations when I was trying to make them happen. I just didn't realize that
I
it.
think so. I think so. So here's a sneak preview at a new resource we'll be rolling out soon to bring this focus to the topic. We've updated and expanded the Climate Health Champions Toolkit that was created by the New York City's Health and Hospitals Corporation to include facilitating nonpartisan civic engagement as part of the new paradigm. And the handbook shows how we, as trusted messengers, can have effective climate health conversations with patients, including some who may have no other civic connections. So we see 4 dimensions of complete care. First, of course, is treating the presenting condition. Second is to provide guidance in order to help avoid exposures, such as ways to stay cool in the heat, ways to avoid smoke and pollution exposure. Third is to develop plans for future events, such as how to keep medications cool when there's a power outage, or how to adjust your medications in a heat wave if you're on diuretics. And the fourth and newest dimension is prevention through civic engagement. We encourage our patients to become active agents in preventing harm through their own civic actions in the community and being informed voters for health. And we can weave that into just about each and every patient interaction, and our patients can bring it back to their circle of influence. We can do likewise with our colleagues, our medical schools, our medical centers, families, neighborhoods, and communities. And through this, we improve the quality of care, full spectrum climate care. Or said another way, not doing this is really incomplete care. So in the manual, 7 major climate health risks are covered. So here's an example of how they present heat. So they recommend leading with a question. Have you noticed it's hotter? Does that affect your routine, or do you feel tired or dizzy? And then explaining simply how those are connected. We're seeing more hot days, or it's harder for your body to stay cool. And then on the right-hand side, strategizing a plan that explains the symptoms, educates the patients on what to do, developing a plan for medications on hot days and medication guidance. But then what we've added is prevent. Until we get a handle on climate change, this heat will keep getting worse. We encourage all our patients to engage with civic, faith, or service organizations on heat responses, and to use the power of your vote to get the policies and leaders we need for clean, non-polluting energy. Are you registered? You can scan this QR code on my badge or this poster to easily register yourself on your own phone in just a few minutes before you leave. So it can be really pretty quick and simple if you're psychologically prepared to do this and have the language. And then they also provide resources. So tools for civic engagement in the clinic are now easily available. We especially like Vote ER, which is a nonprofit organized to integrate nonpartisan civic engagement in healthcare. And they already partner with the American Medical Association, the American Medical College Association, the pediatricians, and the OBGYN group. And you can see here the lovely Karina modeling a voter registration badge, but they also have these posters that are also free and available and make it very easy for your patients to register themselves.
In our smoked out house, that photo.
Okay. So next, we'd encourage people to get your own Vote ER badge. Is there anyone here who doesn't already have one? And just try it out. They're free. So you can either check the link that Margie's going to put in the chat, or scan this QR code, which takes you directly to the site, and they'll send you your own Vote ER badge that you can try out. We hope you'll do that. And you can also get them in batches for your institution, your department, that kind of thing. That's the best way to do it. Already there are 46,000 people across the country at 715 sites that are using these Vote ER tools and trainings. Yeah, okay. So working in this space for the last 5 years, we joined with many like-minded people who wanted to continue this civic engagement work and the Get Out the Vote work led by Margie at the consortium in 2024, but expand it to the broader concept of civic engagement with voting as its cornerstone. So we formed a new organization called Climate Health Civic Health as a national movement with our natural allies in the consortium, including PSR, Physicians for Social Responsibility, the other state affiliates, the Medical Students for a Sustainable Future, and we hope also soon to involve the nursing groups and public health. Doing this work opened our eyes to the issues of voter suppression and disinformation and the authoritarian aspirations of the current administration. Their assaults on science, health, and democracy only deepened our understanding of the necessity of doing this work. We realize that everything is moot if we don't have a functioning democracy. So we need to confront the attempted authoritarian takeover that is anti-legal, anti-constitution, anti-due process, anti-science, and anti-health by standing up and speaking out for democracy. We see this as a Paul Revere moment. Sorry, my slideshows are a little slow here. There we go. And Paul Revere meeting John Lewis, who said, "Be bold, cause good trouble." So here you'll see some of us at the No Kings rally, a group of health professionals standing up and speaking out, leveraging the trust manifested by our white coats. We gave speeches, we wrote letters to the editor, and carried posters that we provided, like "Healthy Democracy for Healthy People." You see Margie here in the back. I don't know if you can see her. Lisa Patel, our fearless leader, here in the front, and that's Robin Cooper in the back. So a few familiar faces and some from PSR. But we issued this warning, analogous to cigarettes, that this administration is hazardous to your health. And we made it clear that human health needs a functioning democracy. So those white coats show up here. You see the arrow to the O, the white dot in the O. That's that group of people in white coats taking part in the No Kings banner. And I must note that Margie told us that people came up to them in the crowd and said, "Thank you so much for being here. We love to see the doctors." Maybe you can tell us more about that afterwards, Margie. So, Karina.
Yeah, we want to emphasize that we really do see health professionals as civic leaders. And for those who think that's a foreign concept, we can look back for generations and probably even farther to see health professionals fighting for public health through civic engagement in the most politically fraught times. So PSR, Physicians for Social Responsibility, made its mark by educating the public and policymakers about the egregious impacts of developing and testing nuclear weapons on human health. So in 1961, pediatricians and dentists showed that radioactivity from nuclear testing was showing up in children's teeth and therefore bodies. That led the way to the Limited Nuclear Test Ban Treaty that ended atmospheric nuclear testing. And then PSR physicians activated health professionals across the US for nuclear disarmament, culminating in the formation of PSR chapters across the country, and then sharing the Nobel Peace Prize in 1985 for it. And then after Chernobyl, journalists turned to PSR for reliable projections of the health effects of the disaster. So that's evidence demonstrating the facts, and speaking truth to power builds trust. And so abolishing nuclear weapons was PSR's first commitment to protecting health. And then in 1992, PSR mobilized for a livable climate, forming its second pillar of protecting the climate, environment, and health. And then fast forward to last month when SF Bay PSR Board of Directors voted unanimously to adopt safeguarding and strengthening democracy as the third pillar of their work. So the hope is that the other chapters are going to follow suit. And then another example for current times, the Union of Concerned Scientists are mobilizing. Their CEO and president wrote an editorial published in Science called Scientists' Role in Defending Democracy. And the group put on a very compelling advocacy training last week. Some of you may have participated, called How Scientists Can Stand Up for Democracy. And two things, Margie and Cynthia and I were talking afterwards, because it was really such a super good training. Two things struck us in particular from this advocacy training. One, the psychologist and co-author of the Anti-Autocracy Handbook, Stephen Lewandowski, said it's that it is not taking a political stance, it's being political. So people who think, oh, I'll just try and do my thing, hide, be in the sidelines, not say anything, not make a fuss, that is being political. Not taking a political stance is making a statement. What we have learned is we must be political to solve the social determinants of health. What we have to be as caregivers or health professionals is to remain nonpartisan while vigorously advocating for the policies that will protect our patients. And then the second was a quote that was read from Kelly Hayes, who's an author and expert on movements. To paraphrase, but it was really said much better in her own words, that when we're feeling exhausted and frustrated, feeling like we're not making a difference, none of us can do this alone. It's the work of movements. So we do our part and invite others to join us. And in pooling our capabilities, we can make a difference together. So we're leaders in our society, and we sometimes forget that. Our voice, our words are respected and trusted. They're trying to break that because the people in power know that we have our own power. So they're trying to destroy that. And our role is to take the responsibility to defend and protect those who cannot do so themselves. So in conclusion, we have to recognize what the people in power are doing right now are not just isolated attacks on climate, health, or healthcare, but part of a bigger picture driven by fossil fuel interests and their allies and their money. So this is our moment to use our trusted voice in society and in our communities. This is our role to be defenders and protectors of our patients.
And thanks, Karina. So we'd love to get feedback from you about how this resonates, how you think we might engage health professionals to activate them on this area, what you think about this new paradigm, and what we can do is in this Paul Revere moment. How can we inspire the health community to stand up and speak out and take any questions? Margie, do you want to be the question moderator? And I'll stop sharing.
Stephen, do you have something to say? You had your hand up? No? You're on mute. Stephen? Oh, well, let's go to Lisa first.
Thanks. I was curious. That was an awesome presentation, and I think it was a very compelling argument, and I think you put it together just beautifully. One thought I had, or question I had, was we're seeing healthcare, attacked in many different ways, obviously, and among that is access to healthcare. We had our state annual meeting last week, and Aparna was our plenary speaker, and she spoke so beautifully about our healthcare system being, now I'm not going to get the right words. I'd have to go back, and I want to go back and listen to her exact words, but we're like we're a pay-for-service system. It's based on sickness, not wellness. And when we she was talking about how closely aligned access to healthcare is with our ability to first do no harm, to reduce emissions, to be more sustainable, and that sort of thing. So I guess my question to you is, do you see a role of also integrating the issue of access to health in some of your civic engagement work?
Yeah. Anybody else want to take that, or I can start? So I think you've hit on something really important, Lisa, and it goes to the idea that we're stronger together and that this is not an isolated problem. We started out in the climate health arena, and so we see climate health people as our sort of natural allies, our audience, that those are the people we can reach. But we see this as like one, I need to think of the right analogy, but one lane in a 6-lane highway that we need to build, bringing everyone along, and each person will have their lane or their special, the thing that they're most interested in, but we're all going to need to pull together. So right now we're building an alliance of climate health groups, but we also, for example, in the speeches that we did, we said, this is a problem with healthcare access, this is this, and we're hoping to start reaching out to other groups and combining that. One of the things I liked about the Union of Concerned Scientists, well, first of all, they consider us doctors scientists, so hurrah! And they have already a big health group, but I think they might serve as the focal point of this kind of movement. But I think we need to get. They may not, it may be the reproductive health groups who are very powerful and organized, or the healthcare access groups who've already been in this area for a long time. I think that's going to be the natural progression, is that we're going to have more and more alliances and working together, even though we're separate groups. That's what I hope to see. Margie, what do you think about that? You've been thinking a lot about the organization.
Yeah. I know that, there's so many issues right now that pertain to health, healthcare access, science and research, public health. It's so many issues that are being assaulted and destroyed right now. So it's really hard to try to focus on what is it that we can do. And I think that all of us are in the climate health group. So that's our natural affiliation. And so we decided we would speak through that lens. But we certainly can support other groups, but I don't think we can do it all. And I think, again, our natural affiliation is with climate health, and so to try to speak through that group, and I think it's very compelling that climate affects all the everybody's health, the planet's
Point
health.
though is the
people's health.
opposite, Margie. I think her point is that if we want to first do no harm, if we want to first reduce emissions, then we need to be seeing preventative care, and the more we can look at healthcare in terms of prevention and primary care, which requires access to healthcare, the more effective we will be at reducing emissions internally. And she had made that point about 5 years ago, and that's where I think the alliance really comes together, is just in rethinking our role in terms of prevention versus sick care, treating care. But anyhow, I'll shut up. I just think it's an interesting way of thinking.
I think that's so important, because when I started my climate and health attention to, I was always interested in it, but when I turned my attention more strongly, when I took the Climate Reality Project Leadership Core training, that is what struck me right away, is there's so many groups. We all have the same goal, really. And so we all just have our different approaches. So I do think that belongs, that's just one of the spokes, pointing to the same, what's the middle part called?
The hub.
The hub. And yeah, that's just a different perspective of the same exact solution to the same problem. So I don't think it's distracting. Some people think it's distracting. Oh, well, that's not really our thing is access. Our thing is this. But if we're all working to the same goal, it just makes us all stronger if we're all together.
So when you were talking about being nonpartisan, I think that is impossible. The Democrats have hounded the few Republicans that joined us along the way. They've primaried them or gotten them out of the way in one way or another. This is a Trump deal. It's a MAGA deal. And the best you can hope to be is maybe bipartisan with a few stragglers in there. But to say nonpartisan is, I'm sorry. The other thing is money is the mother's milk of politics, and CCL has, steadfastly said we're not going to be in the money business, but fossil fuel money will outweigh education. It will outweigh activism of other sorts. And we certainly need to find a way to up the ante in that way. CCL, citizens.
United.
Well, no, the organization you were talking about, the scientists organization.
Oh,
Union
Union
of
of
Concerned
Concerned
Scientists.
Scientists.
They do some of that, and the multi-specialty consortium on climate and health. I saw Lisa Patel in there. Are you all involved with that or not?
Yes.
Every one of you? Okay.
Yeah, we started out as part of the Climate Health Now in California, which became the state affiliate of the consortium. And then we spun off as Voting for Climate and Health, but as a state organization. And now we've expanded to be national, and we're working in the network of state affiliates of the consortium. So yes, we're very tightly affiliated there.
So Joanne has her hand up, but if I could respond to Stephen's comment about it's impossible to be nonpartisan, this has been twisted into a partisan thing. That is undeniable. What we're saying is that our approach is that we're coming at it from a health perspective. We are concerned about everybody's health. I don't care who you are or for whom you voted or what you're out on the streets fighting for, or I still care that climate change and what's happening to destroy the advances we've made and any hope for progress is affecting you. So I think that's what we're trying to say is
good
that
luck
we're
with
not.
that. That's way too slow, and it's not a tiger in the room, and we're just going to have to work hard to get the house under some sort of control. You're going to have to and all that's going to take money. It's going to take more in-your-face activism. It's going to take your hair on fire.
And Stephen, I absolutely agree with you. I think what we're talking about and the reason we're saying nonpartisan is that we want reality-based, evidence-based policies to protect health. And that should not be partisan. We can just stick with this is evidence, this is what's going to hurt people, this is what's going to help them. People make those policies. And that's one lane where we can help change the conversation and understanding among our patients. What people do as individuals may be much more partisan, maybe partisan, who knows what you're going to be working for. But in our professional capacities, that this is how we should interact with our patients and how I think we'll get more physicians involved. Because if we come at this from a partisan sphere, a lot of physicians are going to say, well, no, I can't do that. It's going to alienate my patients. I don't want to do that. So that's why we've chosen this nonpartisan stance.
It worked for abolishing nuclear testing.
Oh, come on.
Okay. Margie, did you ask for Joanne next?
Yeah, I'm sorry, I'm sort of offline. Joanne, please.
Lee and Micah had a question in the chat. Maybe we should go to that first and then come back to me. They're wondering about how to navigate the political nature of this with an employer. One employer, no lobbying is permitted, and many employers ask you to talk to their public information officer, their media work for any kind of speak out op-ed or anything you do in this realm. So how does your organization navigate that?
Well, actually, we've encouraged people to speak out as individuals and to cover your organization logo on your white coat. So speaking out as an individual health practitioner. So going that route, but as a health person, have a health voice. Jay, do you have a comment?
Yeah, I just had maybe a couple of things
Jay?
I wanted to add. Do you hear me?
Mhm.
Okay. I'm really intrigued with the idea of health professionals, health institutions as trusted entities, right? And I think there's other trusted entities in communities that can be brought together that probably haven't come together in a unified conversation in a long time. And I think it's time to make that happen because I think, as we talked about the nonpartisan nature of it, if we don't build it from the community up, we don't drive change. And this is a way to drive change, I think. The last comment I had, and this comes from my practitioner as a 40-year EPA guy, right, on policy. Okay. Because I worked in EJ programs among community development programs, but other things. The other thing is, and I kind of put it in the chat that I think even among the sustainability organizations and crowd, there's a disconnect sometimes between the medical professionals where, I'll be honest with you, some of the sustainability folks look at that, they say, well, all they care about is diseases and drugs. And it's like, no, they don't. They care about prevention and public health just like anyone else does. You're probably just having the wrong conversation because on the sustainability side, they think in terms of carbon and maybe sometimes not about public health or health in how they're doing their calculus. And sometimes maybe we just need to push aside the science a little bit and look at it through the lens of humanity and shared humanity as a place that we can actually start that new narrative that you talked about. So anyway, a couple things I just wanted to add to the conversation. This is an area I've been part of the reason I'm part of the health action team is that this is a practice we need to take back into communities and bring all these different folks together into a new narrative and a new conversation of shared interest. Thank you.
Joanne.
Yeah, we'd love to touch bases with you, maybe set up a time to chat further about these ideas. Thank you, Jay.
Thanks. I appreciate this presentation and the conversation and Jay's comments. I want to play devil's advocate a little bit on a part of what you said. So, where I'm coming from is I'm a family doctor. I have done a lot of work well, not a lot, but I've done work with conservative populations. I've also done quite a bit of work with non-citizen populations. And I've done a lot of work with organized medicine within my specialty area. So some of the things I'm thinking about in terms of where do you best apply your limited energy and how can you make sure that what you're doing is evidence-based and rooted in what's really effective. So my question to that and is the slide from Democracy Index that showed the graph showed my state of Nevada just on the worst side of voter access. I can't imagine that that's true. We have actually super excellent voter access in lots and lots of ways. So I'm questioning that data. And then the studies that I'm aware of that correlate or associate healthy communities with higher levels of voting. I'm only aware of that being an association. And of course, there's a lot of confounding factors like socioeconomic status that can play into that or educational status. And so I'm wondering if you're aware of any literature that actually shows changes in voting laws leading to changes in health. And the reason I'm wondering about that is because on the ground level, as a family doctor, there are 10,000 things with every patient encounter. Right. And I would actually rather use my time on those number 1 and 2, making sure that patients understand their risks and how to be more resilient in a personal way. And when I'm engaging like through my medical society on advocacy issues, it's got to be issues that are top of mind for a majority of the membership, which usually, unfortunately, isn't climate. And so I think in terms of being very selective about where you spend your energy, I'm wondering how you came to voter engagement particularly.
I'll let you answer that, Cynthia, but Nevada is right in the middle, kind of between.
Yeah, I don't
us
know
and
where they
Nebraska.
got that data because we have day of registration, we have universal mail voting, we have
I'm not doubting that.
long-standing
I'm
early
just telling you,
voting.
you're not on the bad side of access. That's all.
Well, it shows us on to the left of center, and that doesn't
Like
make
by
any
a
sense.
millimeter
So anyway, I'm just wondering if there's more data
compared to
than what you presented.
Massachusetts.
Yeah, well, I really appreciate your bringing that up. Um, the I would have to go back and review the information that went into the Healthy People, Healthy Democracy issue, but that was work that came out of the American Public Health Association and some of their allies in democracy. And there's also similar work at the county level from a group called the County Roadmaps, which showed the same thing in minute changes in voting access had huge impacts in health outcomes at the county level. So it's been reproduced in more than one area, but that's something I'm going to look into and I'll see what we can find. That would be useful. In terms of limited time, I definitely concur with that. And that's why I think it's important to use tools like VoteER that make it super easy, where the physician or the healthcare provider really has to do very little except say, hey, this is connected to your health. Being registered and voting matters. Just scan this QR code. It really doesn't take much. And it could be done by other people if we get it integrated into the clinic where the burden isn't on the healthcare provider. It's when you check in, oh, are you registered here on your aftercare visit? The nurse can do it. So we try to, VoteER has an extensive experience with that and tries to make it very easy and quick. They have shown effectiveness of voter registration in the clinics in terms of registering people who often don't have other access and haven't voted before. So it is effective. Your specific question, I'll look into for you.
I think also whether or not wherever your state may be, even if you're Vermont or Massachusetts, however they got there, it still stands that it's worthwhile to and to make sure people understand that it's not just personalities you're voting for, that and it's not just voting, even it's engagement in your neighborhood. So we have a neighborhood environmental group. So what can I do in my little space? When it gets hot and we don't have air condition or whatever in our air pollution, or when the fire happens, that actually was super important that we had a tight-knit community that we're all together. We even to alert each other to the fact that there was a fire or whatever it is. And that when you are speaking with whether it's city council or, your mayor, or whether it's voting for the president or propositions or whatever, to think about your health, your environment, and what is influencing your health in that way. Whether you use the word climate or not, or whether that's top of mind for people. And, it also depends where you live. You don't even have to say that bad word, climate or climate change.
Mm-hmm. And I guess the playing devil's advocate for the devil's advocate, we have to ask, what's the alternative, and what we've been doing so far hasn't worked. The powers are so forceful, the money behind fossil fuels. Honestly, I have this vision in my mind of a dragon in its death throes, flailing around and whipping its tail and wiping out anything it can, trying to survive. And it seems like this is the only hope, and that by doing this, we start to change people's awareness. And because right now they have no idea and they're just taking things at face value. And as we start educating this and helping people understand that it's fossil fuels and the money that are driving all this, and really open people's eyes that there's hope that they can start to see through the disinformation and see how people don't have their best, many politicians don't have their best interest at heart, and start peeling away this unbelievable situation where people don't understand how harmful this is. And even so many doctors who really don't understand how harmful fossil fuels are and don't think climate change is that big of a problem. Margie, did you have any other sense on that?
I'm sorry that the audio keeps going out on me. I can't even hear everybody's comments, so I'm
All right.
kind of trying to stay back because my internet's really bad. I'm so sorry.
Sorry about that.
Well, given that, yeah, we're 2 minutes before
Just at the yeah.
Yeah, let's end approximately here. We're not going to have a meeting in December. So we'll see people again in January. If any of you guys are comfortable, of course, Cynthia's on our team. She's been here forever. Would you mind putting your email in the chat?
Oh, sure.
For all of you. If anybody has further questions.
Thank you for participating. Oops, that's not exactly right, is it? Your email?
No.
Oh, no, I don't type well. Sorry, let me try that again.
You type well.
No, I type terribly. There we go.
You speak well.
You all.
Well, thank you.
It was very good.
Happy Thanksgiving.
You guys did a beautiful job. It was a great discussion.
We're thankful for you all.
Really interesting.